Hi, I'm here with Shannon Douglas, a nurse at Chestnut Hill Hospital, and this is our podcast, Courage, Connection, and Comfort. My guest today is Shannon Douglas, and he's going to talk to us a little bit about his experiences as a nurse, what brought him here to Chestnut Hill, and what he thinks about nursing. So good morning, Shannon.
Hey, good morning, guys. Hey, good morning.
You worked last night.
Yeah, I did. I got off around like 7:30ish.
Okay.
So it was a nice shift.
All right, good. So, Shannon, how did you get interested in nursing?
I got interested in nursing via, as a kid, was in the hospitals a lot with my grandmother, aunt, and little cousin. All suffered from cancer and also diabetes.
Yeah.
So being in there and meeting those nurses, and they used to let me do all type of cool things like take my aunt or grandmother's blood pressure or, prick their finger for the insulin check. All of those things kind of stuck with me, and I kind of just felt comfortable in those environments. So as I grew up and I told my grandmother, hey grandma, I'm gonna fix your leg, not knowing that nurses don't fix legs. But that was what I told her, and I kind of stuck to it.
How old were you, Shannon?
I don't even remember. I think my grandmother passed away when I was about, I want to say, 15.
Okay.
So I'm thinking I was a little young when I was telling her. I was probably around 7 or 8, around that time frame.
And it sounds like you really had a bond with those nurses that were caring for your family members.
Yeah, I was Jefferson and CHOP was the two hospitals that I was at a lot, and I know they're not in our system, but those were the ones that
Yeah.
I was at, the ones that I visited. But I feel like nursing kind of, the way that we were taught in school is kind of universal. So
How did that experience affect how you think about nursing or about your philosophy of nursing?
So coming from that and my philosophy on nursing and how I feel about it, I feel like it allows me to have a lot more patience with my patients than I do in real life.
Mm-hmm.
I think that it made me really caring in the way that I want to, make sure my patients are cared for or got what they need, and kind of just really a really caring side of it. Whereas though I'm not more, some nurses are more logical on what they're thinking. I'm doing this because of this, I'm doing this because of this. But I'm more like just patient-centered. So I think patient-centered care is kind of how I would like to sum it up, because that's just what I'm thinking about. How is this patient doing? How is this person doing in front of me? Versus just, there has to be the science behind it, but my first thought process is, am I caring for them the best way emotionally and, for them?
Really patient-centered.
Yeah, that's basically how I think. That's how I think I do my job. I don't know.
Well, I mean, we've spoken before, and I've heard from Tim Marks, your CNO, that you're quite a team member too. Like you're very focused on the members of your team as well as the patients.
That comes from, basketball and sports and just trying to keep everybody upbeat. I'm really, really positive. So most of the time I'm like, hey guys, you need me to help out with this, that, and third. Let's do it. Let's get it together. Let's knock it out. Because, if the person next to you feels like you got their back, they usually have yours on the other end. You don't need that when you do need that person to help you with something. So I feel like being team oriented and tackling it together. One, it makes you look unified to the patient. They feel like, there's more people here to help me. I don't have to just focus on this one person. So that cuts down on nursing fatigue, and also, makes them feel like, there is a team of people that are actually working to, solve my issues. Not it's just me, the nurse, me, and this doctor that I can't remember.
Right.
It's always like, it's a team of people here. It's always somebody around, and just Chestnut Hill alone, because of the area we're in, it's a big geriatric community.
Mm-hmm.
So a lot of them really, really like the idea of there's a lot of people around to help me versus just that one person.
Can help me. I love how you conceptualize that it saves on nurse fatigue because there's you're all one team, and the patient has the perception that everyone is there to help them, not just Shannon or my other nurse or
Right.
PCA on the floor. which, you know, you think about it, especially for a geriatric patient, comforting, right?
Mm-hmm.
Patient-centered, and plus from an RBC, relationship-based care perspective, right? Care of the patient and care of colleagues is involved there. So I guess I have a couple of questions about that. Two questions, and you can answer them in any order
Okay.
that you want.
All right.
How has your positivity been impacted, or how has your positivity helped, and how have you been impacted personally by working with under the stress that everyone has had with COVID-19, and how do you care for yourself?
So my positivity can sometimes be, probably a bit much because I'm just, I don't know why. I'm always just like, nah, we'll be good. We'll be all right. And some people look at that and be like, Shannon, you're losing your mind. We're drowning. And it's like, no, we're good. And then you help them through that, and then we get through it. And then later on, I feel like, hopefully, they're like, you know what? That was helpful that he would drag me through. It was just pushing people, you know what I mean? So I think that positivity, since I'm always giving it out, when someone needs to be pushed, like there's this one charge nurse, I won't mention her name, but I give her pep talks every time because on our floor, the charge nurse, a shout out to all the 3 South nurses that do charge at night. I'm learning how to do it now from them. And they are stressed because they got to do patient care, have the same patient load we had. Do the assignment for the next day, look at the board. They got all this stuff going on, and then they got their own assignment, and they're like, and I'm like, all right, well, what can I do to help you get through this? And we're gonna be all right.
Yeah.
It's gonna be okay. Tell me what to do. I got a little time. I'll pitch in on what you're doing, and when you do that for them, they're like, oh, thank you, and they get to handle another task that they had to handle. Because charge really should be like, we'll release patients and deal with all the administrative stuff on top, next to what you got going on. But unfortunately, we can't do that. So you got to say, no, let's push through it. What can I do? What can I help you with? And I always do that with every charge that's on. And it's like, hey, you need me to help you with something? And I feel like that pushes them to say, you know what? I can. For one, they can start to delegate those tasks. I feel like they come in thinking, oh, I got all this stuff to do. And because I'm charged, I have to do it. And it's like, no, you can delegate some of that stuff. You can push it on to other people if they're appropriate for the task. Some of the stuff that, it's a lot of nurses here just some people just don't know the job. But it's awesome to kind of say, all right, let me push them and say, hey, let's get this done, let's knock it out. And they feel like, oh, okay, cool, like Shannon's got my back.
Right.
And they feel supported in that. And like I said, that can cut down on fatigue, cut down on stress. And I feel like that positivity, pushing that to whomever for whatever reason during this time of COVID-19 could just help with some of the stress, minimize and say, I'm not in this alone. Because if you look at COVID-19 and the efforts that they are, projected to stop it or to prevent it or reduce it, it's all a team thing. We all have to wear masks, we all have to practice social distancing, we all have to do these things. That's a team effort. So if we all be positive about it and not make it a negative thing, that changes things and will be considered to be a struggle.
Right. Right.
But like it's with that perception. You ever see that meme or commercial where the guy's sitting in traffic like you just were, and he's angry about sitting in traffic, but it's nothing you can change. It's the new normal for that moment.
Yeah.
So if you just decide to say, you know what, put on my favorite quotes or favorite song and sing it. By the time you're done, that you're through that traffic jam and on about your day, versus take that time to be stressed and not even notice that you got out of the traffic jam because you're just so upset. So that's just how I like to look at most things I do.
Are you a singer?
No, I wish. I sing in the shower and yeah, it's not good. It's not good.
So tell us a little bit about your academic career and how long have you been a nurse? Tell us about that trajectory.
So I started out as a TJU major at Shippensburg University, which is a Thomas Jefferson 2+2 program.
Okay.
But I was a basketball player at the time, wanted to play ball, didn't end up doing so, but trying to tackle those two things at the same time and being an athlete, you can end up not, it's just too much stuff on the table at once. So I ended up just majoring in bio at Shippensburg, and I took that bio degree and went into a program at Wilson College, which is an all-girls college at first, and now it became a co-ed college. And this was their first. They used to do BSN to RN a lot, and they had a convocation program run out of their office. But this was the first time they did a just simple, straight up BSN program. So I got in on that because they recruited out of the TEAS test, and that was a fun day for me. But I got in on that, and I graduated in 2019, and I've been a nurse for almost 2 years now.
Wow. And how long have you been at Chestnut Hill?
I've been at Chestnut Hill, I'm thinking, 9 months now?
Wow.
4 more months is a year. So
Wow.
February would be a year.
Wow.
Yep. So, yeah, that was a fun day at TEAS test.
So tell me about the test. Tell us about the test.
So at the time I was working at Apple, which loved that company, had fun at that company. I used to just play with iPads and drones all day. It was a great time, but it was a waste of time. I was sitting there, I'm like, I need to get back on what I need to do. I need to get back into this nursing thing. And this man was yelling at me about how it's my fault he broke his phone and I need to fix it.
Oh my.
It was just like, oh my God, this is terrible. Why am I here? So I went up and said, what do I need to do to get back in nursing school? And I Googled it. And then they said, in PA, you got to take the TEAS test. Most schools are, Roxborough, which is down the street, which is nursing school.
Yeah.
You got to take the TEAS. I'm like, okay, where can I take the TEAS test? Nowhere in Philly. Nowhere in Philly had a TEAS test opening for like the next 6 months.
Oh.
I was like, oh man, that's terrible. That's not a good idea. Has to be somewhere I can take it because within the next 6 months, my A&P classes, I can't use them anymore. So I've got to, you have to be within 4 years. So I'm like, okay, all right, I got to find a place within 100 miles of my zip code. And I'll put that in, and it says, Chambersburg. I was like, I know that town. That's where the mall is, the strip mall, and down the street from Shippensburg. So I drove back out there, and I took the TEAS test out there. I called my friend, hey, coming out there like in a week, take this test. I got to sleep on your couch. And I went out there, took the test, and from the TEAS test, Wilson College, which is awesome. I recommend it if anybody can move out there or lives out that way. I know you guys are based out of Reading. They were recruiting out of the TEAS test, which is smart. Anybody that didn't take a TEAS test, they were just having them week after week. And they were recruiting out of the TEAS test for their BSN program.
Smart.
And they offered me, I was saying, I'm going to this Roxborough, not Roxborough, but it's an associate program. You just get your BSN. You already from out. You know the area. You went to Shippensburg, just coming back out. I weighed my options, like, you know what? It's probably the best bet. 2 years, knock it out. Already had my bachelor's, so that's how I ended up, full circle back in this.
That's wonderful. Congratulations. So first year as a nurse, I've heard about this experience. So I've lived this experience.
Well, this is my second year as a nurse.
Okay.
First year in the hospital.
First year in Chestnut Hill. Okay. So given your 2 years of experience, I think it's 1 year and 9 months here, but about 2 years in total.
Yeah, totally.
So when a nurse starts off in year one, you come in and you're kind of anywhere from scared to terrified, right?
Yeah, you're like, I don't know what's about to happen. All these books say everyone's dying and everything is critical. Yeah.
How did you navigate the first year? And was there a point at which you kind of hit the wall, right? Where you said, okay, like this isn't what I thought it was going to be, and had a kind of different understanding, or did that not happen for you?
I think I still panicked just as much as I did the first day because I still like to look at everything as critical. Like if I see a critical lab, this is critical, let me get this handled. Because I don't want to miss anything. I'm like, I just don't want to miss anything. But I do understand that everything is not as emergent as it may seem, you know, when you first see it. Like when you come out of nursing school, the first thing you think is, oh my God, this patient has a blood pressure of 160 over 80. And you're like, no, this is terrible. This is not right. It's like, wait, Shannon, yes, it's a high blood pressure, but it is not call a rapid, you know,
response
give the
team.
alarm.
Right.
Call the doctor, give the medication, recheck the blood pressure. You go through those progressions now. But before it's like, oh my God, this is crazy. This person has a blood sugar of 250. And it's like, no, calm down. My mind's, I gotta do something. But before it was like, what do you do? How bad is this? Because it's out of the normal range.
Yeah.
Anything out of the norm is like, in nursing school they teach you to just recognize.
Right.
It's out of the norm. They don't really say, you know, how to go through, what to do. It's like, this is abnormal on the you know, NCLEX. As long as you can point out what's abnormal, you know, you got the answer. So coming out of nursing school from the rip, that was what was going on. Like bells were just
Going
things
off.
are wrong. This is wrong. We gotta fix it now. And now it's like, I understand that things don't work like that. It's not. That's not the real world. That's not how it happens. So that's when I hit the wall, and that was probably maybe about 6 months into nursing when I realized, okay, you got to stop panicking and calling these doctors at 3 a.m. You know, because I was working at nights at a acute rehab center where, you know, it's like, dude, this is not an emergency. Like, you okay? Like, you know, I'm there, you know, new nurse by yourself at nights with 20 patients. And you're like, what's going on with this patient? So that's when I hit the wall. About 6 months in, I was like, okay, you got to calm down and try to really, really understand what's emergent and what's not.
Right.
Yeah.
And how did you get through it? Did you talk yourself through it? Did people help you through it?
So we had a group chat from my nursing school, like about 6 or 7 nurses that we were really close and had a study group. We kept our group chat going.
Nice.
And we all worked nights. So it's like, hey, this just happened. So like, you know, do I look crazy if I ask this question? And someone's always like, no, blah, 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 or yes.
Yeah.
This happened to me, do this, do that. Or Google. So I feel like that group chat and that support system from my classmates and Google probably
Right.
helped me through that process, because some part of you doesn't want to look crazy and like, or doesn't want you don't want to look incompetent. But I'm a big on no question is a dumb question. I will ask you how this is spelled, and I already have it spelled right.
Yep.
But I just want you to make sure.
Exactly.
I Googled it, but do you think it's right? Like, that's just how I am.
So getting that support and validation was what really got you through.
Yeah, it was like, just like, hey, is anybody else having this issue?
Uh-huh.
And it's like, yeah, I'm having that same problem. Like, okay, cool. All right, I'll keep working on it. You know, like with stuff, with the skill stuff.
Yeah.
IVs and, you know, getting things done like that. NG tubes. Is anybody else having trouble? You know, just stuff like that. You just ask. And those skill stuff, it comes with time. But, you know, science questions or, you know, is this medication going with this medication? I've known that I'm not going to know all those.
Right.
I tried to. I really, really did try.
But it's how to think and how to access knowledge, right?
Right. So, you know, you go into Epic and you can find out what meds IV can go with what. It'll tell you right there on the screen. Just plug and play, and you can find all that information out. But someone had to tell you that. Someone had to, you know, you didn't have to find that on your own. So,
Right. So I wanted to, you mentioned that Wilson was a female college, women's college.
All women's college for years.
Okay. So were you in the first wave of men that?
I was one of the first males that graduated from the nursing program.
Wow.
I wasn't one of the first males that graduated from the school, but I was of 2 males that graduated.
Wow. So what's the lived experience of a man in a predominantly female school and predominantly female profession?
Well, school, it was fun. You know, I feel like being a male nurse in a predominantly female field, especially with older nurses, they tend to give you a little more slack because
Really?
they know that he's going to be more laid back about things. So it's like, if I go there, they know that he's probably not going to care about the, I want to say, the drama of the floor. He just wants to know, what do I need to do and how can I help? All the other things, you don't get dragged into all the, nuances of the floor. And I don't want to, speak badly about nursing floors, but there are always, stories about this, backstories about that, and just nuances that you run into. And I don't think, guys, we don't get pulled into that stuff unless you actively want to know what's going on, and you get into those conversations. But one of my mentors, Julie Beck from Wilson College, said, Shannon, don't get in the drama.
Yeah.
Don't talk about it. Don't go to it. Don't, if you're frustrated, go talk to yourself in the corner. Don't talk about it with girls on the floor because it's going to cause you trouble. And that's what I feel like. I feel like that's slack where they just don't even bring stuff to you because they don't think you really want to partake in it.
Right. So, and it doesn't seem compatible necessarily with your positivity, right?
No,
your approach and
philosophy. I'm probably
philosophy.
going to say something really positive, and you're going to be like,
Yeah.
ugh, Shannon, what? And that's just how, So I feel like being a female dominated field, I bring positivity and a laid back attitude towards things, and it gives people, I hope it gives people, the power to say, you know what, I can loosen up and not be, because they have this saying that nurses eat their young. And that is because of the nuances, even it's just back and forth competition. And I feel like guys, we bring this laid back. Now, some girls do too. I'm not saying it's just a guy trait. I know women, like some of the girls that came from my class are chiller than me. It's like, oh, that's a blood sugar high tart. It's like, I'm like, wait, in clinical, it's like, no, right? This is crazy, right? No, it's not, Shannon. You're overdoing it. But it's just a nuance that I feel like everybody can partake in it.
Right.
So Phil Jackson, the Zen master himself, and just zen it out.
Yeah, yeah.
So.
Well, and it sounds like that whole concept of nurses eating their young is a choice, right? Like when you connect it to the drama, right? You can either partake in that or you can get about the business of doing what you do best, which is caring for patients. Right. Yeah, and working together as a team.
Yeah, and that whole statement, it doesn't go just for like drama. It's like competition, and I feel like they don't even group me in the competition. It's like, oh, that's just Shannon. It's like, I'm like, all right, cool, I'm good with it. I'm just gonna keep. But that whole thing is just like, I feel like male nurses, no matter who they are, bring some sense of like just. It's a different look on things.
You bring a different perspective to the table.
Different perspective.
Yeah.
So that's what I think the best part about being a male nurse in this field. The worst part is when you get those tricky situations where you got a female patient and you don't want the big, I'm like 6'4", bald head, beard. It's like, I don't want this guy, cleaning me up.
And how's
like,
that?
Oh, I'm harmless, but it's, that's just the perception that they have, and that's okay.
Yeah. And how do you deal with that?
Okay, man, no problem. I'll get you a female in there to help you out. If you need me, if I can't find anybody, please let me help you. But if not, and it's just a hard no, we'll wait.
Yeah.
And that's all, just let them know they're supported in their decision and kind of go from there.
So you really just kind of respect the wishes of the patient and respond accordingly.
Yes, that's all you can do. I mean, I can be, sad about it later, like, oh, I'm not going to do anything, but that's just how they feel.
I'm a big teddy bear. What do you mean?
Most of the time. So it's like, I have no understanding why, but it's like, that's not what she sees, and that's how that's not. And working out in the Chambersburg area, you get a lot of those Amish and, proper women, they call them, and they just do not, it's just like, no, it's not happening.
Yeah.
What was it? Mennonite women,
Mhm.
all of those, that style of, that's just how
It's part of the culture.
part of their culture.
Mm-hmm.
And you can't change that about a person.
Right. So tell me about a time when you really felt good about the work that you were doing and about the outcome you had with the patient or family, something that was particularly gratifying to you.
I got a few of those. One would be working here. I had a patient that was just in a lot of pain.
Mm.
And, beforehand, you get in those situations where people think people are drug seeking or, and the pain wasn't necessarily because if he wasn't getting medication. It was just like his positioning in bed, waffle cushion, heel boots, showing him how to maneuver himself in the bed. And I did that while, family was there, and he didn't have trouble for the rest of the day. He was able to switch the positioning or move himself around, and that pressure ulcer that he was dealing with, it just, he was so happy that someone actually took the time out to show him how to do this or show his family, and he wasn't that verbal, so it was like he would point and show you, but if you weren't taking the time, you wouldn't understand that he just wants to be turned, or he just wants, or that side is numb. He wants
Right.
but he can move around in the bed, so you think, he can shift. You don't think that he needs Q2 timing or none of those nursing cues click for him because he can shift himself. He just wanted someone to sit there and show him how to use the bedroom.
Right.
And something simple like that tells me, like, okay, you got to take your time with people. You got to really pay attention to what they're trying to tell you, because if you don't, you're gonna miss them.
So important.
And that's a simple thing to me, but it stood out to me that it was gratifying that I got to say. And his family came out and said, "Thanks for talking with me, talking with my dad, and showing him how to use that." And I had to show him a few times.
Yeah.
But the fact that we were showing him and making him make a choice and giving him his independence back. And advocating for him and giving him his, it just made him feel better. It made his daughter feel better. That somebody was there to say, they weren't just scooting their dad up and turning him and, tossing him around.
Yeah.
What do you need? Let's figure it out. And that way he was able to, kind of soothe his own, he wasn't drug seeking. It was just, I'm in pain.
Yeah.
But, giving him the drugs were just kind of zonking him out, and he was good for a few hours, but all it's going to do is just
Perpetuate
wake up
the situation.
and could
Yeah.
cause an issue, could cause an addiction, because he had, everything under the sun to give for pain, as far as, morphine or Dilaudid, he had all of it. But it's like, do you need this? And then when you don't, and you start giving patients that stuff over and over and over, they become less responsive, less reactive, so you never get to the bottom of what's really going on.
So slowing down, taking the time, not making assumptions,
Right.
really seeing your patient and understanding the root cause of what's happening, taking the time to critically think about that, and then respond with the best intervention so that you're not perpetuating a cycle that's negative. And I just love that, just that concept of having some deep knowledge and understanding of the perspective of the patient.
Yeah, because it was like, in reports you get, we think he's drug seeking, and it's like, is he in
Wait a
pain?
minute, really? Yeah.
Like, is he in pain? And if he's in pain and they ordered it, it's not really drug seeking. But people get that perception. It's like, no, he's always asking for pain meds. Like, why is he asking? And then it's like, well,
Having that curiosity, asking the question, not answering it with what you believe is
Right.
the answer. Wow, that's really impressive. I have another question. What advice, if you could get a bunch of nursing administrators in a room, or CEOs of hospitals in a room,
God. Oh, you know what? None of my like training nurses on 3 South here. This one. All right.
So they're saying, Shannon, we want to hear from you. What's your advice to us? What do you think is important for us as administrators to know?
Important for administrators to know. I'm gonna step out on a limb here and say, for us right now on the floor is working. We know the job. We know what we need to do. We got good nurses in place to teach the younger nurses like myself. But our main issue right now is having enough people there to complete the job properly. Staffing is a really big issue across the board in nursing period. You can get a job anywhere at any given time, because anywhere right now. It's not just Chestnut Hill, it's not the bigger hospitals in Philly, the nursing home down the street. You can go anywhere, traveling agencies, they got jobs and I think Houston, I saw it on Facebook, paying $6,000 a week. There are jobs everywhere. But why? Because there's a need for it. So to put the right people in place and the right ratio of patients to aide, patients to nurse, I feel like that will allow us to do our jobs with even more diligence, with even more detail, because you're not fumbling over what you got to do next. Like last night, it was me and 5 other nurses, 6 patients apiece, 2 aides on the floor, and 34 patients. That's a lot going on.
It's a lot going on.
So, yeah, we get it done because 3 South, we're champs that way. but it's like, hey,
you make it happen.
You make it happen.
Right, and the question is, how long can you make it happen, right? When it's constant.
I don't want to say that, because I don't think anybody in this field or on my floor, for example, is going to quit on nursing. I'm not saying they won't quit on whatever they do, but to come into work and say I'm taking on this task, I don't know anybody on 3 South that'd be like, I'm not doing this. This is too much. No, we're going to tough it out.
Right.
But it's just like, do I want to keep doing this? No. Would I like the help? Yes. But am I going to do this tonight? Yes, because we got a good team up there. But it's just, going forward, the best way, and this is not about us, this is not about our legs. They block our assignments, they do everything that they could try to do to make it easier on us, and we appreciate it. But this is about the patient. This is about that example I gave you where I was able to take time to teach them how to use that remote to help them position themselves. Those type of things get looked over when you're moving around. So
Right.
moving so fast. Especially when you don't have patients that are just for observations.
Right.
People that are on drips and etc. You look over those small things. And that's my biggest thing I say. If I were in front of a bunch of administrators, go staff it, combine whatever we need to do, but give the patients the best chance.
Yep.
And that's what I would say.
Well, thank you for stepping out on a limb and saying that. I appreciate it. That is the number one challenge that we face, honestly.
I know you can look on.
Yeah.
You look out there on the internet, you can find the jobs. It's like, well, why is that job there?
They're everywhere.
Yeah,
I honestly, and now especially with COVID, it's just.
Yeah, you had established nurses like, well, I made enough. I got a reserve. I'm not even going to do this. I'm taking a year off.
Yep.
And that hurt.
Yep.
You got new nurses that are scared to come out of their shells.
And
this is a lot of.
Exactly, and recruiting PCAs is extraordinarily difficult. That's such a hard job, and I know that what you're describing is exactly what I saw happen at some of our hospitals. Was that after some nurses went through the experience that they had in the spring, they were like, "Hey, you know what? I'm done. And we did. We saw some turnover in May. And then new nurses kind of like deer in the headlights. Wait, what is this? I didn't sign up for this. But actually, you kind of did. And then you're like, whoa, wait a minute. Yeah. And so I will tell you that the chairman of the board of directors asked us this question at our board meetings, and he says, what keeps you up at night? And the answer that I give him is finding the right people and enough people to come in and staff at the hospitals.
It's one of the big things, but we have to continue to talk about it.
Oh, absolutely. And, I guess the other thing too is you can bring people in the door, but what are you doing to support the working conditions for people so that they actually stay, right? So that retention is a huge piece of it. You can't just burn through nurses. So I guess my question to you is, you could go anywhere tomorrow. What keeps you here at Chestnut Hill?
Well, one of my big things is I picked Chestnut Hill because I like I've been going to smaller organizations all my life. And, smaller college, smaller schools, smaller classrooms. I like the idea that in those settings I probably can make a difference than when I go to the machine, right? When I was recruited, the big machine, they brought you in with 30 other kids, played in the basketball gym, they gave you a number on your t-shirt, you got a letter, maybe not. Smaller schools, you're with 2 other guys, you got to know them, you got to know the players, you got to meet, you got to walk on campus, and you got to make more of an impact. And I feel like in situations like that, I gravitate towards them. Like my neighborhood where I'm from in Philly, smaller neighborhood, I know everybody knows me. I want to fix and help that neighborhood because I know I'll be able to make a change in that smaller environment, which will translate into a bigger, someone else might see it from another neighborhood and say, yo, he did something good. I want to do that for here and continue that. So I think what keeps me at Chestnut Hill is the fact that it is a smaller environment and I possibly can make a difference. So like one of my, I think when I first started to think about coming back to Philly, I was looking at here, I was looking at Einstein, I was looking at Roxborough, looking at these smaller ecosystems. And I'm like, why aren't you applying to UPenn? I don't want to go. It just felt so big and like, there's going to be a number there.
Right, in person.
Maybe I probably would have never got to a situation like this where I'm talking to a director in a podcast or be able to talk to who our boss is. So that idea that you don't get to know those people, they're just like figures walking through the hallway, everybody gets quiet. You know what I mean?
Yep.
I just don't like the idea of that. So that's why I'm here. And also, I just kind of like the place. And it's also 7 minutes from my house. So,
that helps.
So that helps.
But it's fun. It's such a feeling. Hospitals have personalities, and when you walk into Chestnut Hill, it's just a good feeling. People are very welcoming, right? And it just feels good. And it sounds like you're the kind of person who's family oriented too.
Yeah, I'm big on family.
Yeah.
Big on family. My mom, and we got a small tight group, but we're big on it.
Yeah. So another question that I have for you:
Okay.
what advice would you give to a new nurse coming into the field today?
Advice today.
Mm-hmm.
My idea I would say to them to be open. And to be open would be to say, like, you're going to have good days, you're going to have bad days, and you're going to have days where you do not know what is really going on. You don't know if it's a good day or a bad day because you're just in that middle period, especially with COVID and just COVID versus regular patients. It's like, don't be afraid of that patient. Just be open to it because, if they don't give you the right PPE and you're going down that hole, then yes, be worried and, do what you need to do to protect yourself. But just be open to the fact that they're a patient as well, and you're gonna have good days with them, you're gonna have bad days with them. But just be open, because that's the biggest thing we need in nursing right now, and also in America. We just need everybody to be open with, with social injustice and systemic racism and football, everything. We all need to be open and just listen to each other. So I think a big thing for nurses coming in, new nurses, be open, listen to what they're saying, because no one's telling you anything just to tell you, just to pull your leg. Everybody's, even if they're wrong about what they're telling you. I've had nurses say things and they're totally wrong. And I'll look it up and I'm like, no. And it was like, well, if you go back a year after that, it probably was the treatment that they did. Like putting ginger ale in a peg tube, but that's not what you do. But at one point, they did that. You know what I mean? So, and that was common. It wasn't, it wasn't evidence-based practice, but that's what they did.
Yeah.
So, be open and just really, really understand that everybody is here to help.
Okay. And it sounds like, if I could sum up, and you tell me what you think, that part of Shannon's philosophy of nursing is be open and make a difference.
Yeah.
Yeah. That's awesome.
That's what you try to do,
And it's what you do every day.
Yeah.
Thank you for that.
I appreciate it. Thank you for acknowledging it. Thanks, Tim, for having me come down here, and thanks to 3 South and everybody over there. Got a lot of people up there that really helped me out a lot. So,
Yeah. It sounds like you're helping out a lot of people too.
I try to.
Yeah.
Some of the PCAs, Miss Sherry picks on me, but everybody else.
Okay. Well, thank you. This has been our conversation with Shannon, and I really enjoyed talking with you.
I appreciate it.
Thank you for making a difference.
I appreciate it. Thank you guys for coming down and also having this thing and having us be able to voice our opinions as far as being a young nurse.
Right.
So there's probably way more qualified people upstairs to talk to, but
Oh, all perspectives, all perspectives. We're telling the story of Tower Health nurses, one nurse at a time.
right.
Yeah, so that's great. And thanks for talking. You're a really good sport for talking to me a second time, so I appreciate that.
Yeah, sorry what happened last time, but
Yeah.
I hope this made up for it. And
Yeah, it did.
works out.
It's great. Actually, I'm kind of glad it happened, because I got a chance to talk to you again.
all right,
Yeah.
awesome.
Yeah.
Well, my email is the same.
All right, thank
All right,
you.
no
Take
problem.
care.
You guys have a nice one.
Yeah, you too. Get some rest.
Yeah, I'm gonna go home and get some sleep. I got
Good
a
for you.
7-minute drive.
All right, 7-minute drive. That you can't beat that.
No, you can't.
You cannot beat